Welcome to the Lesson 2 of the EFN Green Skills for Planetary Health course. Lesson 2 will provide you with a deeper insight into planetary health science, offering an understanding of what planetary health entails and how you can apply it in nursing. This lesson primarily relates to the core competency 1, which is the competence to independently diagnose the nursing care required using current theoretical and clinical knowledge and to plan, organize, and implement nursing care. The core competence of planetary health is based on the understanding that human health and human civilization depend on flourishing natural system and the wise stewardship of those natural systems. Over the last 2 centuries, improvements in human health have led to increased life expectancy, reduced child mortality, and the larger global population now exceed 8 billion people. These health improvements are often attributed to the Great Acceleration. The Great Acceleration described the increasing use of natural resources and the growing pressure on the Earth's natural systems. Unfortunately, this acceleration has pushed many planetary boundaries beyond sustainable levels, resulting in climate change, biodiversity loss, pollution, and other environmental challenges. The graphic displays the concept of donut economics, illustrating planetary boundaries and how many of them have been exceeded up to date. In green, you can see the safe operating space of resource use, which would allow a sustainable regeneration of the ecosystems, no negative environmental or health consequences, and a sustainable human development. The accidents in red, such as climate change and land system change, already have serious consequences for the environment and for human health, as the health of the world's population depends on those ecosystem services. Ecosystem services are fundamental to our life. They provide us with crucial resources like food, water, wood, fuel, medicine, and even chemical compounds for pharmaceuticals. These services also play a pivotal role in maintaining our living environments. They help regulate our climate, protect us from floods, and control the spread of disease. They also contribute for improving air quality, preventing soil erosion, and facilitating essential processes like pollination, which is vital for agriculture. Furthermore, ecosystem services go beyond these practical benefits. Ecosystem services add a cultural dimension to our lives, enhancing our aesthetic and cultural experiences, providing opportunities for recreation, and can support a spiritual connection to nature. Additionally, these services support the natural world itself. They help maintain habitats for various species of animals and plants, safeguard genetic diversity, and create the fertile soil that sustains life. In essence, ecosystem services are the hidden heroes that underpin our well being and the health of our planet. To achieve gains in nutrition, health, and energy use needed to support a population of over 8 billion people, substantial changes were necessary in many of these systems. These changes often affected their structure and function, which came at a cost. These systems lost their ability to provide other vital services and operate in ways on which humanity has relied throughout its history. In essence, humanity has made a trade off. We've sacrificed many of the Earth's supportive and regulating processes to fuel human potential growth and development. These health improvements came at a cost of overusing natural systems to the detriment of the environment and other populations, whether in different geographic regions or for future generations. This means we've essentially mortgaged the health of future generations to realize economic and development gains in the present. This brings us to the planetary health lens. Planetary health views health not solely as the outcome of an individual's genetics and behavior, but also recognized the broader environmental and social influences on health. These influences include underlying drivers like consumption, technology, demographic shift, and ecological factors such as pollution, climate change, biodiversity loss, and resource scarcity. These factors have a significant impact on our individual health. For instance, they contribute to health outcomes such as non communicable diseases, infection diseases, mental health, or reproductive health. The planetary health lens encourages us to think systematically and employ system thinking. It prompts us to consider the broader world and the larger changes in our environment that impact human health and well being, leading to either health or sickness. This brings us to the definition of planetary health as outlined by the Rockefeller Foundation Lancet Commission report. Planetary health represents the pursuit of the highest attainable standard of health, well being, and equity on a global scale. It achieves this by carefully considering both the human systems, political, economic, and social, that shape the future of humanity, and the Earth's natural systems that establish the safe environmental boundaries within which humanity can thrive. Put simply, planetary health is the health of the human civilization and the state of the natural systems on which it depends. For you as a nurse, this means recognizing that the environment influences your patient's health. It can pose a threat, but it can also be viewed as an opportunity. Why? Because it's an additional factor you can leverage to enhance the health and the well being of your patients. By completing this course, you will gain insight into how to incorporate this broader perspective into your nursing diagnose and care plans. You can apply your understanding of how your patient's health is influenced by socioeconomic, demographic, and planetary health factors. This knowledge can be integrated into your assessments and the planning of nursing care, ultimately enabling you to offer a more comprehensive, holistic, and effective level of care to your patients. You can begin by asking yourself and conducting research on how the environment impacts your particular patient population. Keep in mind that the specific disease and risk associated with each patient group can vary significantly. It's crucial to delve into the unique environmental factors of your specific location region, and country, as well as assessing how vulnerable your patients are to environmental influences. In the lesson 3, you will explore the importance of the planetary health education for nurses and discover how it can be effectively implemented. We will also discuss ways in which you can actively contribute to planetary health education at your healthcare institution.